Hi, I'm Kay Mosher McDivitt. I'm a Capacity Building Associate with the National Alliance to End Homelessness. This video series is going to focus on some questions that we get regarding retooling transitional housing. When we've been out in communities talking about options for retooling transitional housing, we find that there's a number of questions that are common to a lot of communities that often come up. So what we want to do with this video is answer some of those questions. One of the biggest questions we often get is, can you tell us about some communities that have retooled transitional housing successfully? So I'm going to talk first about Memphis, Tennessee. In Memphis, the Community Alliance for the Homeless created their 10-year plan to end homelessness. And one of the things they did in preparing for their plan is they really looked at all of the different systems and resources that they had in their community and did an assessment of what they had and what they needed. And they made the decision that they wanted to decrease their transitional housing stock by 50%. So that set that larger community goal. And with that larger community goal then, the work was done with the actual alliance to really work with each of the individual transitional housing programs and help them look at how they could align with this larger 10-year plan to prevent and end homelessness in their community. There was huge amounts of community education that was done with staff, that was done with boards, that was done with all of the organizations to really prepare everyone for the direction that the community was headed in. So one of the first programs that did a transition to their program was called Agape. They had a Families in Transition program, and they had 4 different units that they housed folks in. And then at the end of, completing the program, folks were moved out into their own housing. And what they realized is that often folks were moving, into a community that was not located anywhere near the original places that they had been living while they were in the program, and that it would make a lot more sense to help people be housed within their communities where those resources that they needed to tap into, like transportation, if they were a family, childcare, even finding their jobs, would be located more in the community that they were living in. So they moved to a transition in place model, which in many ways is rapid rehousing. They help people, when people came in, instead of coming into their buildings, they instead moved them directly into their own units and paid their rent for short-term periods of time and then gradually reduced the amount of rent. But all of those supportive services that were being provided within the facility-based model, instead of being provided in the facility, all of those same services were provided to folks in their community. And what they really did was leverage these sort of community of support networks around the families in their own housing in their community. They realized that what they really needed to do was make sure services were available for people in their communities so that when a crisis happened, they wouldn't re-enter the homeless system again. They had resources in their community that they could connect with to help them if they ever encountered another crisis. So they moved again from a facility-based model to a transition in place model. And they found that they actually were able to significantly reduce the amount of time that people were in their program. Once people were in their own housing, they ended up often stabilizing more quickly, being able to get the resources, the employment, the financial resources they needed to sustain their housing. And in fact, while they had very good outcomes in their original program, they found that their outcomes remained just as good and in fact, maybe in some cases increased a bit. So that's one program. In the same community, a program called MIFA, a Metropolitan Interfaith Association, also decided to retool their program. And so one of the things that they did is that initially they just decided that they were going to shorten their length of stay and start serving higher barrier families. With rapid rehousing, they were discovering that a lot of the families that traditionally they had taken into their program that met the eligibility requirements were being rehoused directly from emergency shelter with the rapid rehousing program. So now they discovered that they didn't need to, or they didn't have as many referrals to their program within their eligibility requirements. So they actually started the retooling process by changing their eligibility requirements to take more high barrier households. And they also went with this model of looking at the shortest length of time that people could get rehoused. Instead of completing a program, it went to the model of shortening the length of stay. So that was sort of the first stage, and this can happen in stages. Now that they are also in the process of looking at actually repurposing their buildings and becoming a total transition in place, and actually a total rapid rehousing model. So that's an example of a program that started just by reducing length of stay, working with a different population with different barriers, and in that success in that program have decided to move to a rapid rehousing model. One other program that I just want to talk a little bit about that's it's sort of a completely different model in Lancaster County, Pennsylvania, which is the community that I actually come from. There, the YWCA had 2 floors of rooms that they were providing transitional housing for single women and some for families with children. And again, as part of the 10-year plan to end homelessness in that community, there was a real emphasis on shortening the length of stay and increasing permanent housing options. And they discovered that they had a number of women that would, especially single women, that would come in to stay at the Y that really liked that environment. They liked living in sort of this single room occupancy environment. There was a lot of activities that happened at the Y that they could participate in within, that facility without going anywhere. But then again, after a certain period of time, then they had to move on. So they decided to repurpose some of their rooms into single room occupancy rooms that were not under the permanent supportive housing model. And the reason they did that is because a lot of these people didn't really fit the eligibility and didn't need those intensive level of supports that permanent supportive housing offered, but rather what they needed was just a place to stay where they had more of a congregate environment because they thrived in that environment being around other people. They didn't have the financial resources to afford their own apartment. So what the Y did is they took a number of their rooms, and they still have some rooms that are transitional housing rooms, but they took about half of their rooms and turned them into single room occupancy rooms where people have a lease, they can stay there as long as they need to, and it's a permanent housing option for them. So they're able to come directly from an emergency shelter situation and go right into those rooms as a permanent option rather than as a transitional option. The other thing that during that process, it made them also relook at their entire program, and they decided with the other rooms that they were really focused, again, started with this housing focused approach, and so they stopped telling everybody this is a 2-year program, and instead it was about a program that's focused on the shortest length of stay possible. They actually took 2 or 3 of their transitional housing rooms for women with children, and when a local shelter closed, which meant that there was less emergency shelter for families in the community, they actually transitioned 3 of their rooms to be crisis response rooms. So they sort of took their whole inventory, looked at it in a number of ways, and I think the important thing that they did through this whole process is they worked very closely with the local coalition on ending homelessness, in terms of looking at their funding, in terms of talking to their board, in terms of working through the entire process and really assessing what their program needed to be. They included and included the staff from the coalition every step of the way. And I also, going back to the original example in Memphis, Tennessee, the same thing, having a really strong coalition leader. And again, in Memphis, they call it the Community Alliance for the Homeless. So working with the Alliance for the Homeless, that staffing really provided the support and resources to the individual organizations they needed in their retooling process. Those are some examples of retooling. We hope to be able to add some examples as we get more to our website, so always keep an eye out for blogs that we will do on different community examples and any resources that we put on our website. I'm Kay Mosher McDivitt, and we're talking about retooling transitional housing.